Fully vaccinated grandparents can fly to visit their healthy grandkids without getting a COVID-19 test.
New travel guidelines were issued by the U.S. Centers for Disease Control and Prevention Friday. The relaxed recommendations from the CDC: fully vaccinated people can travel domestically with, quote, low risk to themselves, but must continue to wear a face covering and practice social distancing on planes, trains, buses, and public transport. In addition, there's no need to be tested before or after domestic travel, and there's no longer a need to quarantine after a trip. But while the CDC says it is medically safe for fully vaccinated Americans to travel starting 2 weeks after their final dose, CDC Director Rochelle Walensky explains the recommendation comes with a major caveat.
And while we believe that fully vaccinated people can travel at low risk to themselves, CDC is not recommending travel at this time due to the rising number of cases. We are at 64,000 new COVID cases today, and our numbers continue to increase. We had an increase of 8% today. I still continue to worry that with 80% of the population unvaccinated, that we have a lot of work to do to control this pandemic.
The airline industry praised the change as a good first step. Air travel is down 43% since the health crisis pretty much grounded flying to a halt. But Americans appear to be warming up to getting back on a plane again. Daily TSA screenings are at their highest since the health crisis began. Friday's CDC guidance is different for overseas travelers. There are still restrictions that bar most non-U.S. citizens from the United States who have recently been in China, Brazil, South Africa, and most of Europe. And the CDC is also keeping requirements that nearly all international travelers get a negative COVID-19 test before boarding a flight to the United States. It recommends getting tested again a few days after returning to U.S. soil. But there is one change. Those fully vaccinated no longer need to go into self-exile.